Good afternoon, everybody. Thank you all for joining us. My name is Alex Padilla, proud to serve as the senior senator for our home state of California, joined by some tremendous leaders in this important fight to protect access to health care and quality of health care. You'll be hearing today from Ms. Jessica Altman, the Executive Director of Covered California. You'll be hearing from Jody Hicks, CEO and President of Planned Parenthood Affiliates of California. You'll be hearing from Veronica Alvarado, small business owner and a Covered California member. You'll be hearing from my colleague in public service, Assembly member Mark Gonzalez, in whose district we are standing here today, and we will strive to have time for a few questions at the end of all of our prepared remarks. But let me thank everybody for joining me here today and jump right into it. Now, we're here today because millions of Californians are near a breaking point. You know, when folks spend time figuring out how to pay the bills every month, they see the cost of the groceries rising. They see energy bills on the rise as well. And among other bills that are continuing to go up are healthcare costs. But despite it all, recognizing that working families across the country, not just here in California, are finding themselves increasingly in dire straits, President Trump and Republicans in Congress seem to prefer to shut the government down than to work with Democrats to address this challenge of increasing health care costs. And it's not just what may or may not happen next week. Let's begin with the impact of what they call the One Big Beautiful Bill, which is anything but beautiful. That bill ripped away health care for millions of people who rely on Medicaid. And why did they do that? To underwrite tax breaks for the most wealthy in America. That in and of itself was wrong. But now, Republicans are refusing to extend life-saving tax credits to keep health care affordable. And I'm speaking about all the people who receive their coverage through Covered California. If Congress doesn't act, then Americans are staring down the largest health care increases in 15 years. 15 million Americans at risk of losing their health insurance. And for another 20 million Americans, it would mean a spike in their premiums. And that alone could increase the cost of health insurance by on average 75%. So imagine that, nearly doubling your cost of health care. Now, here in California alone, the stakes are high. More than 1.7 million people facing skyrocketing premiums. Rural hospitals and nursing homes at risk of closing. Californians making less than $62,000 a year could be forced to pay another $100 or $200 a month more in premiums. That's a lot of money. And so today we're here to uplift the voices of Californians who would be hurt should Republicans choose to shut down the government, because it is their choice. Either shut the government down or work with us to address these health care concerns. Now, before I hand it over to the next speaker, I want to offer a few remarks in Spanish as well. Estamos aquí porque millones de californianos se encuentran en un punto muy crítico. Se siente que cada día más el costo de alimentos suben más y más. Los costos de energía siguen subiendo. Y más que nada, más importante que nada, los costos de nuestros programas de salud. Es obvio que el presidente Trump y republicanos en el Congreso prefieren cerrar el gobierno que trabajar con demócratas para responder y resolver este problema para millones de familias en el país, especialmente aquí en California. Porque aquí en California solamente hay mucho en juego. Casi 2 millones de personas enfrentan primas que aumentarán. Hospitales rurales cerrando. Asilos de ancianos cerrando. Y los californianos que ganan sueldos de menos de $62,000 por año pueden ver sus costos mensuales para seguro médico subir $100, $200 o más. Es bastante. Por eso hoy estamos aquí para alzar las voces y las perspectivas de todas las personas en California que tienen mucho y que van a ser impactados drásticamente esta próxima semana. And with that, I would like to introduce Ms. Jessica Altman, Executive Director of Covered California.
Thank you all so much for having me, and thank you in particular to our Senator for bringing us here to talk about health care and for being a champion for Californians and the health care that they deserve. I'm here to hopefully be the voice for the 2 million, nearly 2 million Californians that rely on Covered California for their coverage, for the estimated 1 in 6 Californians that have needed Covered California at some point in their healthcare journey, and the many more that will look to Covered California as they change life circumstances and need healthcare through any circumstance in their life. Covered California is here to serve hard-working Californians who need healthcare coverage but don't have the privilege of a job that provides them with stable benefits and an employer willing to pick up much of the tab. National data shows nearly half of marketplace enrollees are small business owners, sole proprietors, and employees of small businesses who need healthcare but whose employer cannot provide it. Over 1 in 4 farmers and agricultural workers rely on marketplaces. Gig economy workers, freelancers, nail technicians, restaurant workers, these are who we cover. And I'm so glad you'll get to hear from one of our Covered California enrollees, Veronica, here today, though no, there are so many more standing behind her. The enhanced tax credits drastically improved affordability in the marketplace. They both made tax credits more generous to the lowest income people we serve, just above Medi-Cal eligibility, someone making $22,000 a year, and for the first time extended tax credits to middle income consumers and business owners who were previously ineligible, with a rule that says no one in this country should pay more than 8.5% of their income on their health insurance premium. And with these enhanced tax credits, enrollment and marketplace coverage nationally more than doubled, proving that this policy doesn't just make healthcare more affordable, it gives healthcare to more people, and was part of powering California to the greatest lowering of our uninsured rate in the entire nation since the Affordable Care Act. But all of this is on the line. The enhanced tax credits will expire at the end of this year unless Congress acts. We are looking at a double whammy of both the support, these tax credits going away or getting less generous, and then premiums themselves rising and rising more because of the instability created by that loss. What does this mean? On average, what a Covered California enrollee actually pays each month for their coverage will rise an average of 97%, effectively doubling. And from this policy alone, not even accounting for other federal policies that will take away coverage from Covered California members, we estimate as many as 400,000 of our current enrollees will go without coverage, and those that remain will pay more, will face hard decisions in their household and at their kitchen table, and may have to choose less generous coverage and forgo care that they need. I cannot stress more that time is of the essence. In less than 3 weeks, we at Covered California will mail notices to nearly 2 million people in the state of California and tell them what costs will be next year. Open enrollment begins on November 1st, and this is the time that consumers will feel the impact of Congress's failure to extend these enhanced tax credits. I cannot be more grateful to the Senator for standing up and saying that this needs to be done on behalf of these Californians and the many Californians that look to Covered California to be here for them when they need it. Thank you all.
Please welcome Jody Hicks, CEO and President of Planned Parenthood Affiliates of California.
Thank you, Senator, and thank you for inviting me, but thank you for also just having a voice and really shining light on what's happening to our healthcare system here in California. My name is Jody Hicks. I'm the CEO and President of Planned Parenthood affiliates of California, and I represent 7 affiliates that run over 100 health centers throughout the state, including 28 that are right here in Los Angeles County. And as you've heard from my colleagues, and what you'll continue to hear today, is the future of healthcare access in California. It is grim, and especially if Republicans in Congress do not act to protect healthcare coverage here in California. Millions of Californians rely on their healthcare coverage, and it's certainly all intertwined with our safety net, our providers, the people that rely on covered California, but then rely on Medicaid, and what happens when one is not affordable and the other one is taken away. Already, California's healthcare system is reeling from the attacks to the safety net, and every single, in that big, beautiful bill that they like to say, every single Planned Parenthood health center throughout California has effectively been defunded. And so what does that mean? It means that 80% of our population of patients that we serve here in California rely on Medicaid, and we are continuing to serve them, but as of right now, we are no longer able to be reimbursed for those services. We're having conversations with the state and what the state can do to ensure that our health centers stay open, but I need to be really clear, this is not a sustainable way for people to continue to take care of patients. It's just not. We are looking at massive healthcare closures or a reduction in healthcare services. And I also just want to point out the irony of what they did in trying to attack our California values, trying to attack Planned Parenthood for what it stands for the services we provide and the patients we serve. No federal dollars ever go to abortion. So right now, those are the only dollars that we're able to receive, is state-funded dollars for abortion. What they took away is birth control, STI screenings, cancer screenings, mammograms, all of the things that 1 in 4 women know and rely on when they know they can go to a Planned Parenthood health center. 1/3 of those patients across the country, Planned Parenthood patients, reside right here in California. And California was hit hardest. And why? Because California values women, and we value people that need health care. And so we've invested an outsized amount to ensure that people can get health care. And we want to make sure that remains true. For the Trump administration and Republicans in Congress, this was never about saving money. I also want to point out that Congress's own budget office conceded that defunding Planned Parenthood health centers would actually cost American taxpayers $52 million over the next decade because they're taking away such vital services. So we know the defund is intended to punish Planned Parenthood for being the country's leading provider, but we also know that the attacks, it's all intertwined. And I think that's what we're here to talk about, is we all work together to ensure that people in California get the care that they need. And when you attack one piece of it, it attacks all of it. And it's just the people in California, that suffer. Thank you, Senator. When you attack every facet of the healthcare system, as the Trump administration and Republicans in Congress continue to do, you create a crisis. And that's really where we are. We are at a crisis point, and we're at that tipping point. Our fight is not over, certainly. We'll continue to fight because every person deserves access to health care. Every single person throughout the country deserves access to timely and affordable health care, including sexual and reproductive health, but all facets of health care. And that's what we're all here to do. We'll continue to fight back. And I want to thank you again, Senator Padilla, for being a part of that fight, and know that we're here to stand up and protect Californians and health care no matter what. Thank you.
Please welcome Veronica Alvarado, small business owner and Covered California member.
Good afternoon. Thank you, Senator Padilla, for this important conversation. My name is Veronica Alvarado, and I am a founder and owner of Now Marketing, a business that has been operating in Los Angeles for the past 17 years. And that today I'm standing here speaking on behalf of small businesses and how that the impact of the everything that's going on right now will have on us, not only on our health, but just on our finances and our families as well. So today I actually stand here to say that our businesses are being affected over and over again. My monthly premium right now with Covered California stands at just under $100. With this change that is coming, my new premium would be approximately at $633. Businesses right now, as we stand, we're trying to survive. It's been a tough year and we are trying to adapt. But with these type of changes, we are not only impacting our business bottom line, but our families. How are we going to continue to grow and support our local businesses when we continue to get this pressure on what do we need to decide on? Are we deciding on feeding our families? Are we going to decide to keep our businesses afloat? But most importantly is how are we going to continue to sustain Los Angeles? This is our home. This is what we're fighting for every single day. And I shouldn't have to decide if I will have health care tomorrow. Before I got Covered California, I needed to go across the border to get my medical care. Is that what we're going to have to go back to? Because will we be able to afford this? And so thank you, Senator, for championing this. But I think most importantly, we just need to raise the flag for what the fight is and about what we need to continue to do together. It's only in unity and what we do, and I stand here for the voices of all the small businesses that are being impacted day in, day out to try to survive and to provide services for everyone. I also just want to close and say that Senator Padilla, thank you for your leadership and raising your voice. We know that this is not something that is going to go silently, but we're not going to fight. We're not going to stop the fight. Affordable healthcare is not a luxury. It's a lifeline for us. And extending the ACC premium tax credits gives small business owners like myself and thousands across the state the chance to keep our doors open, protect our families, and continue servicing our communities. So thank you for your time. And Senator, thank you.
Last but certainly not least, Assembly Member Mark Gonzalez.
Thank you, Senator Padilla, a voice rising for the voiceless, a guardian of our dignity, and a light demanding that no one gets left behind. Thank you for bringing us here today and for your leadership and for standing tall for Californians in our nation's capital. And thank you to our partners over at Covered California, Planned Parenthood, Ultimate, and every provider who fights every day to keep our communities healthy and to keep our communities safe. And thank you, Veronica, for sharing your story and all of the folks who are out there sharing their stories today. My name is Mark Gonzalez, and I'm the Assembly member representing the 54th Assembly District, which represents the surrounding communities of Westlake, downtown Los Angeles, Boyle Heights, and surrounding neighborhoods. I represent one of the most diverse and hardworking districts in California, where nearly 1 in 5 are in poverty, where nearly 70% of families speak another language other than English, and where parents are already struggling with the rising cost of rent, the rising cost of food, and the rising cost of childcare. My district is also home to 85% renters. These struggles are only being made worse by Donald Trump and Republican allies, whose chaos and tariffs and catastrophic economic agenda squeeze working families at every single turn, every single day. And let's also be clear that this so-called big ugly law or bill is nothing more than an attack. It slashes health care for working families. It imposes cruel work requirements that strip coverage from millions every single day. It cuts food assistance for children and seniors. It guts anti-poverty programs, and neighborhoods depend on that. Meanwhile, Republicans double down on tax cuts for the wealthy, tariffs that raise prices, and billions more in Trump's deportation machine. In my district alone, over 300,000 people, or 62% of our neighbors, rely on Medi-Cal. Another 17% live without insurance every single day, while thousands more depend on the Affordable Care Act to keep coverage within their reach. This is their lifeline. Ultimate and clinics are their lifeline. If Republicans succeed, premiums will continue to skyrocket. Families will continue to face impossible choices between paying rent and seeing the doctor, between putting food on the table or filling a very simple prescription. Or when they wake up in that morning, do they put gas in their car or do they put a gallon of milk on their table? And their new work requirements, nothing but bureaucratic red tape, punishing low-income workers, caregivers, and people already holding down multiple jobs just to survive. And we as Latinos, we are never asking for a handout. We've always just asked for a hand up. And that's why in Sacramento, we aren't waiting. We're working to strengthen California's healthcare system because healthcare is not a privilege, it's a right. And as I shared earlier with folks in the roundtable today, I came from the clinic world. I was born in a clinic. I was the president of Northeast Community Clinics for 10 years and watched many people who were suffered, and we were seeing because of these immigration raids, folks who are not even coming to their own health visits, dialysis appointments that are being under attack every single day. And so it's important to us to push issues like telehealth and get that across so that folks can see their physicians and they can also survive. My mom had a stroke about 3 years ago, and it was a clinic that also saved her life. And being a home care giver is also extremely important. And many folks, and like Veronica was saying, who have to decide, do they go to work or take care of their families? Well, Democrats fight for families. Republicans threaten a shutdown to protect billionaires. Our families deserve better, the peace of mind that their children, their parents, and themselves will always have access to care. California will continue to lead, but Congress, as it was said, must act. That's why I'm proud to stand here with Senator Padilla and this coalition to say clearly we must extend the ACA tax credits. We must protect the health care of millions of Californians that rely on us to be that blue beacon of hope. Because when health care is stripped away, dignity is stripped away, and dignity is something we will never, ever let them take away from us. And now, in his hands, our hopes meet their champion. In his voice, our future finds its echo. Senator Padilla.
Thank you, everybody. And just a couple words in closing here. You've heard a lot, and we can certainly do a deep dive into the intricacies of how one funding source being cut or threatened impacts other funds and programs and services. But the bottom line is this. We want to send the Trump administration and our Republican colleagues in Congress a clear message. Work with us to avoid this healthcare crisis in America. Let's work together to not just avoid a government shutdown for the sake of avoiding a government shutdown, but avoid a government shutdown while addressing this healthcare crisis. Because I know my colleagues hear every day from their constituents like I hear from mine, from cancer patients, from caregivers, from parents of children with special needs. For every one patient who writes to my office or sends an email to my office or calls my office from a hospital bed, we know there's many, many more that are worried about what the impending healthcare costs will mean for them. Americans are scared. Californians are scared. We've been through a lot this year, right? That came up in conversation earlier. Our year started with wildfires, and we have not just the fear and terror in so many communities because of these indiscriminate raids by ICE and other federal agencies, but to the point where some people are afraid to go to their doctor's appointments, to take their kids to schools, to go to work, to go shopping. It's all having a cumulative impact. This is clearly not business as usual. And no, this is not normal. Our country is better than this. The people of our country deserve better than this. So again, here we are, less than a week from the last day of the fiscal year for the federal government. Democrats stand ready to work and negotiate with Republicans, and now Republicans who control the White House, are in the majority of the House and the Senate, have a choice to make. Shut the government down? Is that what they want? Or work with us to address the health care cost crisis for millions of families across the country? Thank you, everybody, and we'll open it up to your questions.
Yes, Senator Padilla, at this point, do you think that a government shutdown is inevitable or less than a week away? President Trump doesn't even want to seem to meet with Democratic leaders. He canceled the most recent meeting.
Yeah, look, it's. I'm not going to give up fighting, but I think the crystal ball is kind of clear. You have a president of the United States who doesn't want to meet with Democratic leaders. You had the Speaker of the House of Representatives who sent the House of Representatives home until October 1st. They're not going to reconvene until after the government shuts down, if it gets to that point. They're not even pretending to try to negotiate. I will say this. There was two measures to keep the government open that were voted on, neither successfully in the Senate last year. The Republican plan and the Democratic plan that would address this health care cost increase issue. The Democratic plan got more votes in the Senate than the Republican plan. Still fell short, but it got more votes. That's got to be our starting point, not the Republican plan.
And are you exploring a run for governor? Why is that a position that would interest you?
Look, I appreciate the question. I love California. California is my home. A lot of work to do here and to continue to do work here. But right now, I'm focused on this because we know who gets hurt the most when the government shuts down. And not to get off topic here, but we know there's a big political question before the voters of California this November with Proposition 50.
Any other questions?
Senador, en español para Univisión 34, dada la respuesta negativa por parte de gran mayoría del Congreso republicano con referencia a poder extender estos créditos, ¿cuál sería el plan B? ¿De qué manera podríamos apoyar a todas las comunidades que van a ser las más vulnerables y más golpeadas?
Sí, bueno, tenemos que resolver este problema. Es el punto de esta rueda hoy. Los republicanos en el Congreso y presidente Trump tienen que decidir, ¿prefieren cerrar el gobierno o trabajar con los demócratas para resolver este asunto, no solo por cuestión de la salud de tantas familias en el país, pero especialmente en nuestra comunidad? Estamos dispuestos para seguir negociando, pero la decisión es de ellos.
And what's your reaction to the Trump administration filing a federal lawsuit against California for failure to produce their statewide voter registration lists?
All right. I think this will be the last question because we're going to start entertaining other topics here. But as the former Secretary of State of California, I know this issue well. And my first instinct when I heard the news was, here we go again. I mean, you may recall in the first Trump administration, he tried to extract sensitive, personal voter information from every state in the nation. And at the time, secretaries of state from across the country, both Democrats and Republicans, said no. So they're back, and this time weaponizing the Department of Justice to try to do that under the pretext of voter fraud. We know that voter fraud is exceedingly rare. But it makes you wonder, given how this Trump administration has been since its outset, what do they want the information for? It's not to protect the integrity of elections. States are doing just fine with that, especially here in California. But we know that if this administration will use and abuse IRS data as part of their mass deportation agenda, then we know that their request for voter information is just a pretext to further fuel their mass deportation agenda.
Do you just want to say anything about what your constituents can do in terms of the government shutdown and fighting for health care? Who should they call?
Sure.
How can they get involved? Because a lot of people just feel helpless. They're either tuning it out or they don't feel like they really know what the effects of the big, beautiful bill could be.
Yes. So for folks who are worried about how a government shutdown will affect them, there's still a little bit of time left. Call your member of Congress, and more specifically, call a Republican member of Congress and tell them to get back to work with Democrats. Let's solve this healthcare cost spike. It's time to do it now.
Thanks, everyone.
Thank you, everybody.